Longitudinal studies indicate that people who have early secure attachments with their primary caregivers have better relationships with friends during childhood and youth and tend to have more stable adult love relationships. And vice versa. People who have had an avoidant or ambivalent attachment history, or especially disorganized ones, tend to have more trouble in later relationships. It is important here to emphasize that what happens during the first year of life does not determine what happens for the rest of your life. That is an outmoded concept and one that most psychologists, including Ainsworth, have rejected. A better model is one that views development as a complex set of unfolding pathways with many opportunities for different outcomes. If one has had unfortunate experiences at one point in life, there is usually an opportunity to return to a more normal or healthy path at some later point in development. In terms of attachment, this means that a baby who has had a disorganized attachment because of maltreatment, for instance, can still return to a normal developmental pathway. This can happen, for example, if her parent overcomes an addiction or some other loving person provides long-term emotional security to her. These changes in pathways can even occur quite late in life, as when an adult who was abused as a child develops an intimate and trusting relationship with a partner or successfully completes psychotherapy. And unfortunately, the opposite can occur. People who have had relatively secure attachments can get off track by tragically losing an attachment figure and being so wounded as to not be able to seek a replacement. An early insecure pattern of attachment does place one at risk for later problems, but does not guarantee that will happen. Life does offer second chances.